We're seeing significant, budget challenges and financial declines as a result of the economic environment that we're faced with. We are finding ourselves in a very significant economic pinch. And it is unfortunately causing us to step back and question what can we sustain? How can we continue doing what we're doing? Do we still try to be everything to everyone, or do we look at some services and begin to curtail or potentially even consolidate or even close some key services? And that's a painful conversation to have with my board. It's a painful conversation for us to have as a leadership team, and certainly if we're forced to go into that sort of situation, it's going to be a very painful thing for the community as well, because there's nobody else. It's just us. And that would require patients to completely really have to remodify their approach to getting their own healthcare. And that is a very sad thing to have to think about. I worry about what that means for patient health, what that means for outcomes, what that means for mortality, life expectancy, all of those things that we know have declined throughout the pandemic as services were scaled back, or there was just a clear patient disinclination to interact with healthcare in general throughout the COVID-19 pandemic. I believe firmly in driving a value-based care agenda, and I think that our focus needs to definitely shift from this fee-for-service model, which we've endured and thrived on over the course of the past many decades, to one that's more balanced and really optimizes health and wellness and quality and safety and the patient experience and total cost of care management. We have to evolve as an industry in that direction. And I think many organizations are starting on that journey. And certainly at Bassett, we are as well, and taking it very, very seriously. So I would really implore our lawmakers to look very long and hard at evaluating some short-term opportunities to create support for healthcare institutions and to address the looming and what appears to be at least a semi-permanent effect on workforce. Those are the two major areas I would really want to see some change.